We shot a video before on lower eyelid safety. It's actually been probably about 1.5 years since I shot it. There was a lot of static going on. Didn't have a brilliant videographer like Stephanie shooting me before, and had a lot of cross interference with my telephone. So that's been there, and I've also shot a video about identity. I want to merge those two concepts and focus on one specific idea, which is the shape of the lateral canthus. The lateral canthus is this area where the upper and lower eyelids merge and join. The reason why I don't make a cut on the lower eyelid is that I don't want to change this canthus. And I really believe that if I change this canthus by 1 millimeter in any direction, inward, upward, downward, or outward, I change your identity. And so in the other video we talked about identity, which is restoring identity of youth, not altering it. And it's really important that you understand that where I've looked at the entire face and where I've seen the most distortion is not necessarily with a bad facelift, which probably will come in as a number 2, but the number 1 focal point that I've looked at the entire face that creates a distortion to one's identity is right in this little focal point called the outer canthus. And a lot of people say, you know, the fear that I have of cutting the lower eyelids is I'm going to round the eye and make it look like a droop dog. But doc, you know, I don't get that. I don't ever get that. I rarely get it, or it's a rare chance I get it. And I can tell you that that's not the only problem. It's not just this eye having a functional issue being pulled down and looking terrible. It's also a slight pull this way, either an Asian look or just a very bizarre look. It's not even an Asian look, because an Asian look is more of an almond eye. This actually further rounds it, because if you bring this tighter and the natural shape of a triangle is distorted where it's pulled in just a little bit and rounded, you'll see that that distortion creates a serious problem. So it's not just that the eyelid could drop, it can be actually pulled up or tucked up. So these plication sutures that are used to sort of tighten that area, the slightest modification of that shape can create a profound distortion to your entire identity. And I have so many people come through to me with that distortion that it actually drives me crazy. I look at them and they don't even know it's a problem. I look at them, I can't even get around the fact that their eyes don't look natural. And they don't actually, if they see it, they don't know what the problem is. And the real problem is the fact that there's canthal distortion. It was really interesting because I had a lady that had a significant canthal distortion, and she was seeing her makeup artist, and I was looking at her, and something, it looked already off, and I didn't know why it looked even worse. And she said her makeup artist told her to paint her eye this way. And what the makeup artist had her do was actually take the upper eyelid and draw a pencil that goes down and curves up. It actually worsened it, because the makeup artist did not see what the foundation for the problem was, and just arbitrarily defined a line drawing. And even though I don't put makeup, I did understand what was the problem was the lower eyelid being distorted upward and rounded. So I just had her pencil in a longer width, just drawing that line out of the bottom eyelid to make it look more triangular, more almond shaped, and less rounded. And I don't even mean this rounded, I mean this rounded. And that, she says, oh my God, my eye looks better. And I know you haven't done anything for me yet, but why does it look better? It's because I understand where the distortion level is. And so if you don't understand, if you've had eyelid surgery and something doesn't look quite right about your eye, even though you may have been overlifted, overcut, oversucked out, done something that doesn't look right, I challenge you to look at this canthus. And the best way to understand that distortion is go back and take a look at your photos when you're young and start looking at models' photographs of this area and see if this area is either blunted in, rounded down, or pulled outwards, or pulled slightly up this way. Any distortion on that 360 degree will create distortion and make it look unnatural. So how do I fix this? Well, one is if it's really pulled down or pulled out, you're going to have to see an oculoplastic surgeon, someone to actually do a mechanical functional reconstruction of the area. And I actually work with a lot of oculoplastic surgeons for them to do the initial work and groundwork to get the eyelid shape functionally and cosmetically improved. Then I actually do the finishing pieces where I do a fat transfer, and essentially what I do is I create the illusion of length by taking an eye that's overly rounded and actually creating volume into the outer part of the brow, and it visually lengthens the eye back toward a youthful condition and back toward less distortion. And that's a powerful way to restore identity. Not 100%, but maybe 80-some% to the point where someone looking at you hopefully won't see the distortion without necessarily needing a cut. So only the time that I would send you to an oculoplastic surgeon and do some of the more difficult work is if in fact it's so far beyond what I can do, then I'm going to work with another specialist to do that. But in a lot of cases, if there's a minimal distortion, maybe 1 millimeter or 2 going in the wrong direction, just lengthening the eye can help. But it also just reinforces the idea of why I almost never cut on the lower eyelid, because I always say never, but practically almost never make a skin cut in the lower eyelid because there's too much of a risk of any level of distortion.